upcoming to the last topic of the day with our honored speakers who will join and come up on this stage to talking about the biohacking with intermittent hypoxia. Ladies and gentlemen, so right now, please join me in welcoming the Assistant Professor Dr. Patana Teng Amnoi, Assistant Professor of the Anti-Aging and Regenerative Program of Thurakit Bandit University. Please welcome.
สวัสดีครับ Good evening. These lectures will be conducted in English. No need for translation. I think it's easy for everyone to understand. I'd like to start by this statement. We think that we live under the world of 20% oxygen concentration. We believe that we need oxygen. Well, my first statement is, if you don't learn to think outside the box, you never see a miracle. And as a doctor, you need to create a miracle that I have done so many times in my life. What is biohacking? We all believe that we have to get old. We never care that the scientific process, scientific principles, that's why we get old. If you know the scientific process of aging, then why can't we reverse it or slow down it? However, anti-aging principles require a lifelong treatment. You cannot do something like giving someone statin and expect them to not have a heart disease. Long-term statin guarantee they will face complications. So it cannot be any dangerous side effect. And the second thing is cannot be too expensive. You charge patients who come to your anti-aging clinic 50,000 baht a month. How long they live until run out of money and you kick them out from your clinic, right? I face my patient, I treat them until the last day of their life. So it cannot be too expensive, and the patient is the one who have to understand and work out and do it, because the principle is simple. Eat less, you live longer. Exercise and no stress. Oh my God, you don't eat, you have to exercise, and they ask you to be, oh, I don't have any stress. That's difficult. We need help. But anyway, the healthier lifestyle you have, all the studies shows that it increases health span and life expectancy. I would like to focus on the power plant of everybody's cells. It's called mitochondria. Mitochondria is like the energy power here. If the light is switched off, you cannot see anything. I cannot perform the lectures. And if your mitochondria is off, you cannot have a life. Why our mitochondria is decayed? Because it's metabolize oxygens into energy, and it increases oxidative stress. So start like this. If you think that hyperoxygenation is good, I need oxygen, more oxidative stress. More food, more oxidative stress. So maybe you have to think differently outside the box, that first, you need to eat less. Sometimes you need some bit of hypoxia, and of course, you need antioxidant. In the past, we tried to tell you this, like, oh, eat less, live longer, take antioxidant, no more. We have the way to reverse your mitochondria. It's called mitochondria bioenergetics. It's a hot topic for the past few years. It started by mitochondrial biogenesis. Mitochondria contain their own genome. So it can divide itself. It tries to divide itself. It can fission and fusion. Like I give myself mesenchymal stromal cells once a year. So these young MSC will provide young mitochondria to my old aging mitochondria. And what about mitophagy? It means the cell will eat up the bad mitochondria, okay? Get rid of this zombie mitochondria and you stay younger. It's no longer a dream. If you read more scientific paper, there's a lot of ways to do mitochondria bioenergetics. It starts by create a new mitochondria. Of course, you love NAD. It's a supplement for mitochondria, but don't forget coenzyme Q10 or BioPPQ. That's a new one to help you create a new mitochondria. What about damaged mitochondria? How can you fix it? Good news is all you have to do is hypoxia. Hypoxia can create a new mitochondria, can fix your mitochondria. Studies show what is happening. You want to create mitochondria. The mitochondria has a pathway. It's called mitochondrial biogenesis. It requires this gene. It requires nerve 1.5, actually nerve 1 and nerve 2, not 1.5. PGC1 alpha and AMPK. AMPK is the one that you stimulate when you take metformin, but metformin had side effect. And besides, it stimulates only AMPK. You want the entire pathway. Nerve 1, PGC1 alpha, and AMPK. You can do that with intermittent hypoxemia. The process is simple. There's a machine. The machine you can breathe, and oxygen concentrations from 20% will go down to about 15. Don't worry, you're not going to die because we will measure your oxygen level in the blood all the time. Once your oxygen go down to, let's say, 80%, it will recharge and put oxygen back to you. After the process of 45 minutes of hypoxia and hyperoxia, the process is done. Is there any study prove that it increased longevity? Oh, still to come. But right now, more studies come in animal. But the fact is, the baseline, the basic side is important. When I had the machine on myself, first is increased hypoxic inducing factor. This machine will increase nitric oxide, so you don't have to take Viagra as much. You can reduce the dosage of Viagra down. Okay. You can increase nitric oxide simply by hypoxemia. And also it increases vascular endothelial growth factors. So I feel kind of what's going on here. Nowadays, when you have diabetic wound, when you have surgery problem, you want to increase vascular blood flow, but then you put your patients into hyperbaric. Hyperbaric inhibit HIF, hypoxia-inducing factor, is inhibit vascular endothelial growth factors. I don't think it's working. You need to learn to think outside the box. Scientific show is hypoxia that increase vascular endothelial growth factor. When I say that improve mitochondria, it needs to be proved that it works. Put it this way, blue zone in America. You want to know who lives longest in America? Check the zip code. You're going to Denver, right? Congratulations. It's where people live longest. But you're going to feel suffering because you haven't trained intermittent hypoxia just yet. Train it before you go. It's a high altitude with less oxygen. When I first went to Denver, I could not breathe. I walk around, I exercise regularly, but turns out that I feel funny. I could not breathe because I'm not used to it. I'm not used to low oxygenation. But the people who live in the mountain, people who live in Colorado, is the one who live longest in United States. Not surprisingly, because they have better mitochondria biogenesis. What about cellular metabolisms? I told you it increased HIF, hypoxic inducing factor, increased vascular endothelial growth factor, increased nitric oxide, so it means it reduced blood pressure. also it enhances AMPK PGC1 alpha sirtuin 3 signaling that enhance your mitochondria to biogenesis. You don't have to do anything. Breathing hypoxia and your mitochondria will rejuvenate. How easy is that? How easy is it? I love this machine. I would do it every week if I could, if I have time. And the other reason that why hypoxia is so good, it stimulates mesenchymal stromal cell. You heard about the wavelength that stimulates MSC. People believe that oxygen is good for the cells is the one who never cultivates stem cell in their life. I have a lab that cultivates stem cell, and we all know that stem cell love hypoxia. It's like a nature. Look at this. Inside the bone marrow, oxygen concentration only 7%, adipose tissue is only 10%, muscle is 10%. None of these cells, stem cell, live under environment of oxygenation of 20%. So we need to have hypoxemia to stimulate our own stem cells. Anytime after I have my MSC injection, I will go under hypoxia. So my stem cell from 20 millions could go up to 100 million. Short-term hypoxia potentiate therapeutic function of MSC. The study shows. And it's as simple as the simple machine that I use every month. Also, the difference between cartilage, we heard about osteoarthritis. Hypoxia stimulates cartilage to grow, while regular oxygenation inhibited. But for the bone, it needs 20% oxygenation concentration. You cannot treat patients with hypoxia if you have cancer, because the stem cell will grow as well as cancer stem cells. Of course, if you have chronic lung disease, they barely survive under 20% oxygen concentration. Forget about hypoxemia. But other than that, for all of you, regular people who want to stay young, want to improve mitochondrial biogenesis, maybe hypoxia is good for you. It shows that hypoxia, intermittent hypoxia, can improve cognitive function and functional exercise in older people. So when I saw some of you send your parents for hyperbaric, I'm just so sad. These children, these doctors, is murdering stem cell of their own parents. Oh my God. Actually, they have to send their parents for intermittent hypoxia. It increased exercise tolerance, even the elders. And what about sports? In certain places in Germany that won a lot of Olympic goals in Russia, they have hypoxic training for their athletes. And that these different pictures from different studies. The studies done in Korean Paralympics team. But I show the pictures of Thai national cycling Paralympic team. This is different. I hope that some Thai doctors, someone who responsible for Olympic teams or Paralympic team of Thailand should hear about this, should try this, because it will make a difference in terms of training and make these Paralympians can reach their goal much better. I have a chance to interview Paralympians in my television show 10 years ago, and I asked him, what made you become a Paralympian, the champion, even though you have this ability? His answer is, I never consider myself a cripple. I never asked for anything. I never asked for special treatment. To me, I'm normal. I may have one good leg, but I can use both legs as much as other because I have to work harder. I call that show คนหัวใจไม่พิการ disabilities of the body, but not the heart. The study also show after you have stroke, intermittent hypoxia can improve motor functions in animals, run duration, and average speech. Unfortunately, no one dared to do it in human except me, because like I said, I always think outside the box. This lady come to see me. She's 50 years old. She have hemorrhagic stroke. After 1 year of neurologist treatment, including all of the physical therapists, this is all she can have. She smile. She want to get better. So I give her magnesium, CoQ10 fish oil, active B, vitamin K2, and prostaglandin E1. I also gave her mesenchymal stromal cell treatment and hypoxia session. After 10 sessions of hypoxia, here is the result 2 months after.
ช่วยกันช่วยกันปอของเล่นใหม่สุนันท์ตักด้วย
เอ่อไออะไรนะอเล็กซานเดอร์แมทธิวกับริชาร์ด
I try not to cry, but I can cry because I'm human.
แกมองกล้อง
You know, as a doctor, and even though you're not doctor, you want to make a difference in your life. I don't know because of hypoxia, or maybe because she never lose hope. Maybe a little bit of hope, a little bit of help, or a little bit of hypoxia, and then miracles do happen. Thank you so much. ขอบคุณมากครับ
ขอบพระคุณค่ะขอบพระคุณผู้ช่วยศาสตราจารย์ดรนายแพทย์พัฒนาเต็งอำนวยค่ะ Thank you very much dear assistant professor Dr. พัฒนาเต็งอำนวยค่ะ Ladies and gentlemen, and right now, our food, our dinner is ready to serve to all the distinguished guests, ladies and gentlemen, during the next section. And the next section on the stage is the